Hello, and welcome to Living Real Change with Piedmont Healthcare. I'm Dr. Jane Morgan. Through this platform, I will introduce you to visionaries who have journeyed to empowerment and are now living real change within their communities and across the state of Georgia.
My name is Parker Lincoln. I am Director of Child Advocacy at Children's Healthcare of Atlanta and the state lead for Safe Kids Georgia. It started in 1988 with a campaign, actually through a pediatric trauma surgeon who kept seeing kids come in and having to talk to parents to say, your child is injured, your child passed away due to something that could have been prevented, and really wanted to start a mission around preventing those injuries and keeping those kids safe. Safe Kids Georgia is one of the wonderful programs that the hospital supports out in the community. A huge mission here at Children's is injury prevention. So Safe Kids fits so nicely into the work that we do in the community and wanting to keep kids safe and healthy.
How has it evolved over the time from where it started to where it is today?
We've, over the past 30 years, have moved from just a campaign effort into on-the-ground programming. So the growth has become not only in awareness, but we distribute equipment, we talk one-on-one with families, we provide car seats, we provide water safety, education, life jackets. Almost every single year, Safe Kids Georgia interacts with about 300,000 kids. That's a huge number of kids. Over the past 30 years, we have seen a significant decline in the number of injuries. Anything that caregivers need to think about when it comes to injury prevention, Safe Kids is out in the community helping families to make a difference.
How do you empower Georgians and families to sort of take up these initiatives and move forward with them and implement them?
Safe Kids really is grassroots. So empowering families is really about being in the community. In our 32 coalitions throughout Georgia, there is a coordinator or a person in that community that's well embedded. They're usually connected into a local health system, the fire department, public health, and they create connections with all of the different organizations in their community. That person with Safe Kids is the connector to the families. So empowering families is really about being in the community. In the next couple of years, we're really focusing on building out the coalitions in Georgia. We just want to strengthen those partnerships. And so there's a lot of growth that can happen to reach more families. So really strategizing around where can we take this to make sure that families across the state are empowered with the knowledge, education, and resources to keep their kids healthy.